Hi guys, it's Arti. Welcome to my video on my lymphoma journey. So I had a couple of quick updates to make, and I'm going to try to keep it a little bit shorter just because I think long videos are really boring for people to watch. So I made some notes. I'm just going to look down on that to make sure I cover everything. So I had my previous chemo 2 weeks ago, and this chemo actually went a lot smoother, I would say, overall. And that is mainly because the first chemo, you don't really know what's going to happen. And there's a lot of sort of, uncertainty that you have in terms of how you're going to tolerate it, how your body's going to tolerate the chemo and all the other things that they're pumping inside you. So the second time around, you're a bit more of at ease because you know what the routine's going to be. And the other big thing specific to non-Hodgkin's lymphoma, the R-CHOP treatment, is the Rituxan factor. The first chemo that you do, the Rituxan is put into your body very, very slowly. So the first time in my first chemo cycle, the Rituxan took 7 hours to administer, and in the second cycle, it took 3 hours to administer. And that is because if your body tolerated it well the first time, they normally go faster the second time with the knowledge that your body tolerated it well the first time, and that's usually the indicator that they follow. So the the day of the chemo, just like last time, first thing you do is you go in for blood work. The blood work, they check all your vital things, they check your white blood count, they make sure that all your basic blood work is all normal and at least to the point where you're ready for chemo. So you wait for those results. While you wait for those results, you normally see your oncologist. I saw my oncologist just for a few minutes, just a quick check-in. He asked me how I was doing and all the regular things. Then the chemo starts, and they again start your IV line. They put fluids inside you, and they start you up on some of the other medications that help pre the chemo, which is the steroids and the Benadryl. Again, the CHO part of CHOP was administered first. It took about 2 hours. It's pretty quick the way the nurses do it. It's just in and out. Once they have a good vein to go in and your vein is taking the fluids, they just kind of keep administering it. And after the chemo part ends, then the Rituxan. And what happened between the chemo and the Rituxan, I can't remember which part it was, but my vein stopped taking the drugs. So there was a beeping sound in the monitor, and then the nurses had to come and kind of pat around my vein, and to make sure that it was able to receive it, they had to kind of poke around and put a warm compress, and that normally helps to relax the vein so that it's able to take the medication. Thankfully, that worked, and it happened a couple more times, but every time they would put the warm compress and they would kind of ask me to move my, gently move my arm, and that normally did the trick. So thankfully there were no problems in that area. The Rituxan also, my body tolerated well. Just like last time during my Rituxan, I asked for Ativan, and that is actually a anti-anxiety medication. But in my case, it doesn't really put me to sleep or anything. What I basically use it for is anti-nausea. Anti-nausea is one of the off-label effects of Ativan. And I really found that it helps me tremendously with the nausea during the treatment. So in the first chemo, before they gave me Ativan and the Rituxan started, I immediately started to feel slightly nauseous. So once they gave me the Ativan, not only did I feel a bit relaxed, the nausea didn't happen. And so this time took Ativan from the beginning. Nausea didn't happen. I was able to tolerate the treatment, went through the treatment. I had my iPad with me. My husband was with me. It was a start to finish 5-hour process this time, as opposed to 9 hours last time. So it was shorter. And, everything is a bit more sort of known to the nurses and to the care team, so it goes faster, and it's also known to you. After that, I came home. I was pretty fatigued. You know, day of the chemo is one of those days where you really should just take it easy. Don't plan on, you know, anything big or having any visitors. You're not really going to be up for it. It's quite exhausting to even talk on that day. So after I came home, I just kind of, you know, relaxed and lay around for a while. And so that was the day of the chemo. I'm just looking at my notes. And then, so post-chemo side effects, mainly fatigue. So there is just a lot of fatigue because the chemotherapy is, you know, putting quite a burden on your body, and your body is really like working with that, all that poison inside you. So whether or not you can see what's happening, there's a lot going on inside. And so fatigue really does kick in. I get these dull headaches as well. And that I normally am okay with managing without medication. So that is there. There's dull aches and pains throughout the body. I felt this time that they were a little bit more focused around where my lymph nodes are. So in the neck region, in the armpit region, and then also in the region where my cancer is the most active, or is the most aggressive, I would say, and that is in my pelvic region. So for me, that's where the majority of the discomfort and the dull pain is. So it's not a throbbing or that kind of a pain, it's a dull pain. So I've been just managing without taking any pain medication through that, because I just have found that since it's not throbbing, and since it's not preventing me from like moving or doing anything, I'd rather not take pain medication, and take pain medication when I absolutely have to take it. So I'm not advising you to take or not take it. It's really your judgment in terms of when you decide to take the medication. Okay, the next thing I want to talk about is the Neulasta. Just like last time, they put a like a device on you, and it's got an inbuilt needle, and 27 hours after the end of your chemo, it activates, and your body gets a surge of this medication called Neulasta. And what that does is that it actually triggers your bone marrow to produce white blood cells. So one day after chemo, your white blood cell count is probably almost wiped out. And that's why you need the Neulasta to trigger the white blood cell production in your body. Now, last time I had this done, a couple of days after the Neulasta, I had excruciating bone pain. And it was quite bad because it's like bone marrow inside your bone pain. And I could not get comfortable. I couldn't lie down. There was nothing that I could do that was helping it. The stretches, nothing were helping. So this time I talked to the nurses, and they told me to take Claritin, and take Claritin basically for the first week after the chemo. And that apparently really helps with the bone pain that comes with Neulasta. And it's again one of those things that nurses know based on experience. This isn't something that Claritin is given for. Claritin is obviously a anti-allergy medication, but it does help. This time I took Claritin for a whole week, and I have not had that kind of excruciating pain. So that's another good tip. You know, the Claritin really does help. The other thing that I wanted to talk about is steroids. So steroids are given to you the day that you're receiving your chemo, and then you take steroids for 5 days following your treatment. And the steroids are pretty intense. if you've never been on steroids, then you will definitely feel what it's like. And if you've been on steroids, then you kind of know what the drill is. I never really was on steroids before going on chemo. Steroids give you just a surge of energy and they help with inflammation. And it's kind of like fooling your body into thinking that you're actually, completely fine. So they're very necessary. It's very important during chemo to take it, but what happens with me is that it just makes me so wired. I feel really sort of like not just wide awake, but just kind of like really like I'm, on a like a constant sort of go 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 go, and it gives you this while you're fatigued, but there's this like strange surge of additional energy that feels like it's chemically driven. So it's a strange feeling to have both fatigue and this kind of chemically induced energy, but obviously the good outweighs the bad, and I follow the doctor's orders to the T. And if the doctor says this is what you're going to take, then I take it. I don't try to change the medication on my own, and I wouldn't actually recommend anyone doing that. So no matter what side effects you're experiencing, please stick to what your doctor has said. And then obviously call them if you're experiencing something, and then they can tell you. And unless they tell you to reduce the medication or to give you something else, please don't do it. During chemo, it's just so important to stick to the regimen, because all the hard work and all the suffering that you're going through with the chemo, you don't want to negate any of that treatment by altering any of the medications and doses and things like that. So steroids. Another thing that steroids do, because they make you sort of wired and infuse you with this surge of energy, they actually make it really hard to sleep. And I've had insomnia for many years, and during the steroids, it's just out of control. I mean, it's really, really hard for me to sleep. So just something to be aware that it's that 5-6 day period during chemo where, in addition to fatigue, it could be hard to sleep as well. As tired as you are, actual sleep is hard, and I really think in my case it's because of the steroids. So regardless, it's part of the process. You just go through it and I did. And the other thing that I wanted to talk about is drinking fluids. And I did a lot of research, and I'd actually tried this myself, is on the day of chemo and the 2 to 3 days after chemo, what I did is I just forced myself to drink lots of fluids. So especially on the day of the chemo, I drank like 10 glasses of water, just constantly sipping on water. And the day after chemo and the couple of days after chemo, same thing. I like water, but I also have coconut water that I was drinking. I also have like lemon water, ginger ale, and I try to drink at least 1 glass of cranberry juice because it's an antioxidant. And any liquid is good, but certainly the water is the best liquid. And obviously I'm not like encouraging you to have soda or anything, which I don't drink anyway, so I didn't have to stop that. But drink. And that really, really, I believe, minimizes the side effects of the chemo. So the chemo is doing its work, no matter what. But what you can do is try to minimize the side effects by just washing it out of your body. And the best way to do that is to drink water. The last thing I want to talk about is a little bit not about the symptoms. It is more on the lifestyle side of it. I have been lucky that through the first 2 treatments, I've been feeling more or less okay. Nothing dramatically bad. I mean, obviously I'm not feeling great. I'm going through chemo. It's not an amazing feeling by any means. But one of the things that I've been doing is keeping busy, and busy mentally and busy physically. And physically, by physically busy, I mean I keep active around the house. I do everything that I would normally do, at least, 90% of what I would normally do. So, basically going from room to room, sitting in different parts of the house, folding laundry, making the beds, putting the dishes away. Just not, just being careful with exposing myself to cleaning things like that contain high levels of toxins. But other than that, just been keeping busy, moving around the house. I am taking walks outside, so open spaces are very good for fresh air. I've been very careful with going into closed spaces, just because of the germs that you get exposed to. And in New York City, I mean, absolutely, I'm avoiding taking the subway, or going to restaurants. As much as I love going to restaurants, and we did go to a couple of restaurants, but it wasn't worth it in the end because I just felt so stressed there every time I heard someone sneezing or I saw something that was unsanitary. And, I mean, it's just, it wasn't worth it to experience the restaurant. So we've just been eating, ordering out and getting the food delivered, and to get a bit of a change. So keeping active, going for short walks, in open space, fresh air. I should be doing more walking outside, but I haven't been doing as much as I would like, and that's purely because of weather. It's winter in New York City, so it's really cold and dreary, and I also don't want to catch a cold. So, other than that, really energy level, important that you keep it up. I'm not suggesting, you go run a marathon and overexert yourself, but just walking around is actually, I think it's good. It gives a nice change of scenery. And then the other thing that I've been doing is I've actually been working, and working meaning my profession, my job. And I have very supportive colleagues who know what I'm going through. So I've been able to work from home. I log in, I, pretty much clock in almost a full day of work every day. I've been taking meetings by phone and participating that way and working with my team. In fact, we had a very big milestone last week where we organized several big events, and it was a very high level meeting. And I was able to do that from home, just working with my team and managing them, and all of that was a very, very useful distraction for me. Keeps my mind occupied. I'm not one who can just sit around and watch Netflix for hours and hours on end. It's not. I just get bored and I get fidgety, and I don't find that particularly useful. So actually working has helped me through it. But of course, not every job has that possibility. So I guess again, I would say I'm lucky in that. And that's pretty much it. Just been taking care of myself, being careful around people. We've had some friends visiting, and of course I always tell my friends, or my husband tells my friends, that if you're sick, if you have a cold, please don't come visit. It's not because we don't love you, but, really, like, this is not the time for me to expose myself to unnecessary germs. My kids, my husband, my father's here. If they have a cold, I mean, there's really nothing I can do to stop that. Life has to go on. Just wash hands. I wash hands all the time, and I keep disinfecting, particularly like doorknobs, the bathroom area, that, like the main things that you're touching, just disinfect them so that there's no sort of obvious way for you to pick up any infection. But other than that, just try to be as normal, quote unquote, as you can. It's really hard to, but the less that you freak out about things, the better it is, because then you kind of get yourself worked up, and there's, it's not really going to change the outcome in any way, and it may even make things worse. So hang in there, whoever else is going through this. Good luck to you, and also wish me good luck. Again, I'll post my next video after the next chemo, which will be the 3rd out of 6. So that will be like I'm going to be so happy to be halfway done. But so far so good, guys. Thank you so much for watching. Again, turned out to be a longer video than I wanted. I just always seem to go off on a tangent. So thank you for watching. Until next time, ciao.